really for those workers trying to get to work, worrying about getting petrol to get to those people. What's your reaction when you hear the government say, and the Petrol Retailers Association, that actually this could all resolve itself in 2-3 days' time by the end of the week? Have the people that you work with, the people that you represent, got that time?
No, like I said, we needed a solution last Friday. There should have been a plan ready to go. And because the government has refused to acknowledge that there is an issue, refused to acknowledge that there is risk to the health of older and disabled people, we've had to, we haven't been able to invoke the civil contingency plans which the local resilience forum are responsible for. And so home care workers and other essential workers have been left trying to find fuel themselves. And you have to remember that many of them start their first visits are at 7 in the morning. Many of them don't finish until 11 o'clock at night. Then they're expected to drive around the countryside looking for fuel, are they?
Yeah, that's interesting. You make a really good point at putting their cases across. What have some of your members been saying to you about the lengths they've had to go to and what they've had to put up with simply to get to the people they need to?
Well, we had a message this morning from one of our members saying that they've got 3 pool cars and 7 vehicles that their staff use. Not one single one of them had any fuel left in it. So they were all desperately trying. One heavily pregnant care worker had to try and lug cans of fuel just to fill up the car so they could go and visit. It's been really, really difficult. And if you live in a rural area, if your local garage doesn't have any fuel, you may have to drive 15 miles to the next one. It's not at all unusual for home care workers to drive 100 miles on a single shift. So they're constantly having to fill up their cars. And we needed help last Friday. Here we are on Tuesday talking about how it might all be resolved by this Friday. It's just not good enough.
So what would you say to the government this afternoon?
That they need to take their responsibilities for our population, the well-being and health of our older and disabled people far more seriously than they appear to be doing at the moment.
And Dr. Jane Townson, there does seem to be some debate going on as to who should be on a key worker list. We saw this in the pandemic when it was asked for essential workers to have priority at places like supermarkets. Who should be on that list? Obviously, care workers, frontline NHS staff, but then you have professions such as teachers. People argue that it's essential for them to get to work to teach children because the knock-on effect of teachers not being able to get to school is bigger for the wider community. Who should be on that list, in your opinion?
It's obviously a tricky one, but I would say that for our sector, it's not just a matter of inconvenience, it's a matter of potential harm resulting if people don't receive the care and support they need. I think during the pandemic, there was a good list in the end, the care workers, teachers, obviously anybody involved in transportation, bus drivers and so on also need to be able to get fuel. But in some cases, council vehicles, for example, councils will have their own fuel supplies. So some of the larger companies have already got fuel, but it's for the kind of key workers that can't access it easily. And it would be easy to fix. You have maybe an hour, 6 o'clock to 7 o'clock in the morning, when there's priority given, vouchers so that fuel retailers know who is eligible.
Yeah, there are things that can be done. Jane, have you had any luck going through official channels in terms of trying to get some kind of action to be taken? Obviously, you're here on Sky News, sticking up for your members, saying that they need help today, as the British Medical Association has said as well. In terms of local council going directly to MPs, have you had any luck going through the official channels to try and get some traction on this?
Government, no luck at all. We've just been told that they're considering the situation. Councils are very keen to support, and in many areas are, but they are tied by the fact that unless government declares there to be an issue, the civil contingencies plans cannot be enacted. So that has tied the hands of some of the local resilience forums who would have helped normally. But obviously councils have a statutory responsibility for safeguarding and for care of older and disabled people. So where they can support providers, they are. but it's been very difficult.
Yeah, you mentioned the word difficult. It's been a difficult couple of years for your profession in general. When things go wrong, like the pandemic, unplanned as it was, it seems to be your profession that's first in line to take a battering, if you like, and maybe last in the queue to get help. Is that how your members are feeling right now?
Because if you remember, at the beginning of the pandemic, they were making their own masks, turning bin bags into aprons. Now they've been told they've got to go and find their own fuel and use their own contingency plans. It just seems as though, and this is coming on top of, as you say, the pandemic, and we're experiencing the worst shortage of home care workers that anyone can ever remember. So it's the staff that are there are having to do very long hours, and they're absolutely on their knees. They're crying with exhaustion, many of them. And this is just another problem that they're having to encounter.
This also comes at a time when the minimum wage is up for discussion. It's been a hot topic at the Labour Party conference in Brighton. Again, the minimum wage affects your profession. What would you say to people watching about the profession of being a carer, a caregiver, somebody who works looking after the most vulnerable people in our society? What would you say to represent them today, to get them in the coming years, as we come across crisis after crisis affecting this profession, to start taking this profession seriously and give it the due care and attention it needs for people who are doing the most amazing job for those who need it most?
What many people don't fully understand is that home care now is largely only funded by the state if people have quite substantial healthcare needs. So our members have to have substantial skill and experience in handling medicines and dealing with catheter care, stoma care, end-of-life care, complex dementias, frailty in the community. And they need substantial training and experience to do that. This is not a minimum wage job. We need to recognise and reward the skills and experience that our care workforce display every day. And I need to say as well that they play a vital role in helping people to avoid ending up in NHS hospitals, which we also know are under pressure at the moment. So we're really concerned that the care workforce is nurtured and developed and properly recognised and rewarded by our society for the vital role they play.
Well, Dr. Jane Townson, you've done a fantastic job of representing your members here on Sky News Today and sticking up for them. Thank you very much for taking the time here on Sky News Today.